Okay, this is my post-concussion syndrome journey. I made this video first of all to talk about my post-concussion syndrome journey. I wanted to focus on all the things I have learned, and I wanted to make sure to put them all in one place. Third, I wanted to use it as a possible educational tool for other people in my position so that they don't have to search for all these things as I have had to. Fourth, I wanted to show my extreme gratitude for so many people who are praying for and caring for and helping out me and my family. We feel so blessed. I also wanted to point out that this video is about 41 minutes long in 3 separate sections. It is not movie theater quality, so be forewarned. Lastly, I wanted to point out that throughout this entire journey, my family and I have always felt we are held in God's hand and always been taken care of, and always felt that we could just put our trust in Him. Now most days this is how you will see me. I will up wearing an ice pack, I'll have earplugs in, and I'll be able to do okay. Right now I don't have my earplugs in because I have to hear a little better. Alright, you see this race car picture behind me. 13 months ago, I was working over 50 hours a week. I was doing renovations on my house. I was taking time to play with my kids, my 4 young kids. I had lots of energy and I was always busy all the time. Now you see the picture of the Model T Ford. Now I'm a Model T Ford from the early 1900s. I do things slowly, and I have lots of scheduled breaks and unscheduled breaks. In between, I spent months in bed in severe pain and many months unable to leave my house or have the lights on. Perhaps an easier way to imagine it maybe is thinking of a computer now versus a computer 20 years ago. Real simple things or not so complicated things at the same time I can do for quite a while. More complicated things, the more often I get the blue screen of death and I need to take a break. Or at least that's what we called it when I was teaching the computer. Alright, this video is going to explain some things about concussions, post-concussion syndrome, and my journey with them. First, a quick review about concussions. If you want to know more, I suggest you see Dr. Mike Evans. He has all kinds of videos online. You can see them on the screen now. It's a great examples. He does a great job with them, so I'm not going to go into them too much. There are a few great apps to put on your tablets or your phone regarding concussion, and I highly suggest getting them, looking at them a little bit, and so on. Alright, so we know a hit can cause, or a body can cause a concussion. We also know a shaking motion, such as shaken baby syndrome, can cause a concussion. Okay, so something that causes your head to go backwards and forwards, or just one of those directions really quickly and stop, can cause damage to your head, and quite severe damage. Alright, so we also know that concussions now in the medical field are called mild traumatic brain injuries. Now mild means how long you were unconscious. It doesn't refer to the severity or the length of the injury in any way. It just refers to how long you're unconscious. Most concussions as adults, you recover in about 2 weeks. Most concussions for kids, it might take a little bit longer, but usually you all recover. About 15% of concussions can take more than 6 months. And recovery isn't quite the same. For some cases, it can take much more than a year. And as we know with shaken baby syndrome and some other things like that, recovery doesn't happen totally. Alright, we also know some people, for whatever reason, have better shock absorbers in their brain. You have your skull, your shock absorber liquid, and then your brain. Just like some cars, you can go over potholes continually, never break a tire or blow a tire or injure your car at all. Other cars, they hit a pothole and the tire breaks and the brakes break and the shocks break and your whole axle falls off. Okay? You can't really control much about it. You're born with whatever shock absorbers you have. You might be more likely to get concussions or not. That's just the way it is. All right. We also know concussion is related to chemical changes in the brain. So your hormones and your chemicals are kind of skewed and thrown way off. And that kills some of your brain cells. And you do have brain elasticity that will cover up for those killed out brain cells depending on how many there are. All right, so if it's chemical changes, then an MRI or a CT scan won't show it, because those show the structures of your brains, the actual parts and blood flow. Another example, I know I'm probably saying too many of these, but think of telephone poles, telephone wires in your house. The MRI will show the telephone poles and the telephone wires going to your house. They'll even show that there's a current, some electricity going to your house, the blood flow moving around in your brain. But what they won't show is what's in that blood or how much is going. So you might have, think if your hydro, normally you have what, 200 amps going to your house? Now you have 20 or 15 amps going through your house. What will you be able to do? Not nearly as much. One thing at a time, back and forth. Okay. So keep that in mind. So there's not really a test now that shows whether you have a concussion or not. And that makes it really hard for doctors. There are some new tests coming out called fMRIs, and there's a few other tests as well, newer technology, that are available, that are in research hospitals, or in research settings only, not allowed for the public generally to use, and that do show those changes. There are a few things that make you more susceptible to getting a concussion. So if you think about it, whatever you've had happen in the past that has thrown off those perfect chemical balances in your brain, that makes you more susceptible to future ones. So if you've had depression or anxiety or ADHD or past concussions, all of those things make you more likely to have your chemicals thrown off again. For me, I've had at least 5, 6, maybe more than that concussions in the past where I've had headaches for weeks. I ignored them. For the most part, I said, I'm just going to tough it out. I took some extra medications and I just kept going, slowed down a little bit, and I never thought concussions could last more than a month or more than a few weeks. All right. There's also something called second impact syndrome. And this is if you have a concussion and you're still badly impacted by it, and then you have a second one, it can cause exponentially more damage to your brain and possibly even be fatal. If you have a concussion, you have to take it more seriously than I did for my first 5+ concussions I had. And even this one, I didn't understand what was going on in the first place. Okay, so let your brain heal. Okay. Usually, the 15% of people whose concussions last more than a month are thought of as lazy or malingering or just don't like work or all those things. In reality, probably none of that's true whatsoever, and it's probably just that they have sustained much more brain damage. All right. Anyone who knows me will also know that I have ADHD tendencies. I struggled with depression some in the past, but I had major ankle injuries, and I've had many concussions in the past. So I'm like super vulnerable, though I never realized it or thought about it. All right, let's get on with the story. 2015 was a balmy, sunny day. It was a Monday, Thanksgiving, and I decided, we have a bungalow, and I decided I was going to expand the closet underneath the stairs in our basement. So I was taking out the 2x4s and removing the nails, trying to make it safe. And there was one really stubborn nail. And I decided that I was more stubborn than this nail, more determined. Let's use determined as a better word. So rather than use a crowbar or a block or put the hammer sideways or even a sawzall, I decided I was going to try a different approach after my original attempts did not work. I was going to put both feet on the piece of wood, reach forward as far as I could, and then snap my whole body back, and hopefully that would release the nail. Not a wise move. I did that. I had a lot of force going backwards, and then my body stopped, but my head snapped back. And I got this kind of whooshy feeling, like there was water dripping inside my head. In reality, that's sort of chemicals that are getting loose and leaving in the unbalance in your head and killing off brain cells. But at the time, I just had this whooshy feeling going on, and I thought, I've had that before in some of my previous concussions. That can't be true. I can't get a concussion from a whiplash incident. I can't get a concussion from nothing hitting me, and I for sure can't get a concussion from this. No one's gonna believe it. I don't believe it. I don't remember what happened with the nail or the piece of wood, or much about that time. I do remember going outside, talking to Tanya, my wife, and saying, I think I got a concussion from trying to remove a nail. And we thought, that's ridiculous. That's impossible. So we went for a walk and ignored it. And then I started over the next few weeks, I started getting headaches every day. Worse and worse and worse headaches. And I started to become more and more irritable and snapping at people and less diplomatic throughout. And I was taking more and more drugs every day. And one day, we had a nice field trip to London from Sarnia on a nice bus. And I left my head against the window for a while, and it was rattling for quite a while. Didn't think anything of it. By 2 weeks, I was super depressed, overwhelmed, irritable, tired, and I just thought my world was ending. I had no idea what was going on wrong with my brain. I didn't associate it back to that concussion event. I was just totally lost. And I'm going to pause for a minute now because my headache's getting quite sore, so I got to take a break.